living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Many people take care of your health needs. One way to ensure you get better, safer care is to make sure all healthcare providers and healthcare settings have the same information. In a world of electronic health records, this is possible through Health Information Exchange, or HIE. Welcome to Healthy Living for Life, show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back to Healthy Living for Life. Joining us to talk about HIEs is Dr. Monica Berner, President of Blue Cross Blue Shield in Montana. Thanks for being on our show, Dr. Berner.
Well, thank you for inviting me, Sarah.
What is an HIE?
Well, it's really a fancy name for what I see is an extension, a modern extension of how we manage health records. All of us can probably remember when we've gone into our doctor, and I remember as a physician, dealing with paper charts. And if your physician didn't happen to have your chart when you came to your visit, they didn't have any of your healthcare information available. And then over the past 10 to 20 years, most clinicians have transitioned to electronic medical records. You see the doctors and the nurses and their staff working on a computer. I mean, that's just the natural progression of how we manage information, not just in healthcare, but across the spectrum. What people don't necessarily recognize is that all of that clinical information is trapped within a particular electronic medical record that is proprietary to the clinic or to a hospital. And it's very difficult for us to share then that clinical information from one hospital to another or one provider to another if they don't have the same electronic medical record. So the Health Information Exchange is essentially a highway that allows us to share that clinical information electronically from one system to another.
So there are different kinds of health information exchanges, right?
That's right.
And they're not all statewide.
No, there are not. As you can imagine, larger healthcare systems, if they have different electronic medical record systems within the hospital compared to the outpatient clinic, perhaps they need a health information exchange even within a university or a larger system so that their clinicians can share that information. Sometimes a local community has decided they want to be able to share that information. Some of them are within a state, across a state. So there are a number of ways that organizations can come together and decide to share the clinical information.
So give us some examples of the types of information that might be shared in an HIE.
So again, I would go back to kind of the anecdote of imagine sitting in your doctor's office and the doctor says, you know, I'd like to perform a chest x-ray or a particular lab test. And you say, well, doctor, I just had that 2 months ago with someone else across town or even across the state. So if you're a patient in Helena and you've been seeing a specialist in Billings and that specialist had ordered that test, your physician in Helena does not have automatic access to that test. So they're either going to have to call the physician in Billings and ask them to send it or fax it, or ask you to go to Billings and get an electronic copy on a CD or a printout copy and bring it back. So Health Information Exchange essentially allows at point of service, your clinician to access that clinical information. So it's all clinical information. It is lab results, it's chest x-rays, it is recommendations from your specialists, it is surgical notes, it is a list of your medications so that when you go in to seek services, your clinician can have a full 360-degree view of your clinical condition when they're seeing you.
So I tested the concept of an HIE with some of my friends and asked them, you know, do you know of what an HIE is? Have you heard the term? And they hadn't. So is it really that new?
No, it's not that new. It's new in Montana, I will say that. But there are at least a dozen or more states that already have health information exchanges up and running. And as I mentioned earlier, there are integrated health systems that have them up and running. We attempted to put together an HIE here in Montana several years ago, and due to the newness of the technology, it just wasn't successful, because an HIE essentially has to integrate with each individual system in each individual office and hospital. And so the technology has really come a long ways in the past 10 years or so. It's time for us here in Montana to begin to look at it again, because it is up and running in other places and working very well and positively impacting patients' health.
So you talked about Montana having an HIE a few years ago.
Yes.
So what is Montana doing now as it relates to an HIE?
So what Montana is trying to do we've put together a group of clinicians and healthcare payers and patients and folks from basically every facet of the healthcare continuum, and said, how can we come together collectively to create a health information exchange that we believe would be valuable and that we can all trust and feel comfortable with to facilitate better care across the state. And in doing so, we've created an organization called Big Sky Care Connect. And it is just a fledgling organization, but it has a representation from across the spectrum, a number of leaders, and currently we are in the process of selecting a software platform that would support a health information exchange and be deployable across all of the hospitals here in Montana.
So when you say a software platform, tell our listeners what that is.
So my expertise is clinical, and my expertise is not IT. I will confess to that right away. But I imagine, so when I think of it, what I imagine is trying to connect an Android phone to an Apple phone. And you've got a number of different systems, and they store the data in different ways, and they have different repositories, and you have to have a system that connects those two types of phones. And that's really what we're looking at from a health information exchange perspective. You're looking at a system that can connect multiple electronic medical records and then store that information so that it can be extracted and used.
Thank you for that information, Dr. Berner. Coming up next, we're going to take a deeper dive into how HIEs can mean better care for patients. Stay tuned, we'll be right back. Welcome back. We're continuing our discussion with Dr. Monica Berner about health information exchanges, or HIEs. Thank you so much for that information. I learned something. So we talked about Montana not having an HIE, but are there local examples in Montana of health information exchanges?
Sure. So we are just at the tail end of wrapping up this pilot that we did in the Billings area. And we identified that the 3 different large clinics in Billings, so Billings Clinic, St. Vincent's Hospital, and Riverstone Health, had all embarked upon an initiative to identify superutilizer patients. And superutilizers are those folks that tend to go to the emergency room a lot, have serious health problems, but perhaps don't have a primary care provider to be able to wrap their arms around them and help them take better care of themselves. And with the support of a grant from the Mountain Pacific Quality Health Foundation, these 3 entities, provider entities, had decided to come together, which is a feat unto itself, and work to take the best care of these patients. But what they didn't have was the ability to identify if a patient would go to the Billings Clinic emergency room twice, and then perhaps St. Vincent's 3 times, and then show up at Riverstone. They weren't sharing clinical information. So the health information exchange was a solution for that. So together with these 3 healthcare providers and Blue Cross and Blue Shield of Montana, we decided collectively to do a health information exchange pilot in the Billings area. And all 4 of us connected with a particular vendor, IT platform vendor, if you will, and we agreed to input our clinical information for the benefit of those patients and the benefit of the healthcare providers that were taking care of those patients. And we were successful. So as I mentioned earlier, we had a health information exchange in Montana that struggled to connect with systems. And this time around, we were able to connect with 3 separate electronic medical record systems and the Blue Cross and Blue Shield of Montana claim system to share that clinical data. And we were able to accurately identify those superutilizer patients and deploy folks out into the community to help them with their health needs and to get them connected with primary care providers.
Excellent. And I can't imagine how challenging that was, and I know firsthand that the outcome was good. Since Mountain Pacific was involved, we actually saw reductions in readmissions, better quality.
Very exciting. It's very, very exciting when you can utilize a new technology to improve patients' health and improve the quality of the services that we're providing to them within a community.
So now let's switch and talk about costs. So do HIEs actually result in reduced costs for consumers?
Absolutely. So in the communities and states where HIEs have been deployed successfully over the past several years, in particular what we see is a reduction of redundant services. So imagine, as I mentioned earlier, you go into your doctor and they want to order a chest x-ray or that lab, and they aren't able to quickly access the information that you just recently had that x-ray or that lab. The first thing they're going to do to be able to take care of you quickly is just order another chest x-ray and order another lab. So again, you have duplicative services. You've paid for something twice, really, for the same outcome. So those sorts of things will save money. Additionally, it increases safety for those patients. Imagine going into the emergency room and perhaps you're not able to share any information about yourself, but you've never been in that city before and you've not sought care in that city before. The emergency room physicians are going to, through the HIE, be able to quickly pull up what type of medications you might be allergic to, what type of clinical conditions you have, if you have high blood pressure, if you have a neurologic condition, if you have diabetes, and they'll be able to accurately diagnose you and treat you in the best way possible. So again, not wasting time, not wasting money, and not potentially doing harmful care when they can access that information at their fingertips.
So what about providers or practitioners? I would imagine that they would see cost savings and time savings with an HIE.
Yes, that is true as well. You may not see it, but your physician has a number of folks working in their clinic on a daily basis, just working to get information, faxing information back and forth, trying to get the results from a consultation with a specialist, trying to get records from across town. And imagine if they were able to pull that information up electronically while they're sitting in the exam room with you, instead of having these folks spend days, sometimes weeks trying to access that information.
So talk to us about how an HIE can benefit an insurance carrier like Blue Cross Blue Shield in Montana.
Sure. Well, I mean, I think quite simply, anything that improves the health of our members is going to improve our rates and the cost to you as a member. Secondarily, as we are transforming how we pay for care from paying in a fee-for-service to a fee-for-value world, and simply what that means is instead of paying for units of service, we're paying for improved patient outcomes. As I've already mentioned to you, health information exchanges can absolutely improve patient outcomes, and they can allow us to actually measure the quality of the care that's being rendered. So I can then work with a particular clinic and say, are all of your women over 50 getting their mammograms? Are all your kiddos getting their immunizations? Are all your diabetics having their feet checked and their kidneys checked? And we can do that by sharing clinical information that we wouldn't otherwise have.
So in the few seconds we have left, can you tell us when the Montana HIE might start functioning?
Yes, so we are super excited, and Big Sky Care Connect is currently in the process of putting together an invitation to bid and then a request for proposal for that software platform that I mentioned.
Thank you so much, Dr. Berner. If you've been listening to this episode We will continue it, and you're wondering more about the security and privacy of your healthcare information. You don't have to wonder anymore. We'll talk about that next. We'll be right back. Welcome back to Healthy Living for Life. We're continuing our discussion about health information exchanges, or HIEs. We're joined now by Dr. John Griffin. Thanks for being here, Dr. Griffin.
My pleasure.
So you are, and I'm going to look at your title, the Chief Medical Innovation Officer at St. Peter's Health.
That's right.
So Mountain Pacific views itself as being innovative. In fact, one of our visions is to be a go-to resource for driving innovation in healthcare. Your title intrigues me. What is it you do at St. Peter's Health?
I do a little bit of everything. I'm kind of the doc that you cannot put in any box. Right now, technically, what that means is that a lot of our ancillary services, as well as IT, report up to me. And our job, in lots of ways, is to recreate the technology platform of St. Peter's Health. Our vision at St. Peter's is to be gold standard in healthcare in Montana by 2025. And in order to achieve that, we've got to have a gold standard health information technology platform. So that's my job.
So I understand that St. Peter's Health recently affiliated with the University of Utah Health.
That's correct.
So talk about patient records. Are you able to share records from St. Peter's Health with the University of Utah system?
Oh, it's a great question. No, in fact, we aren't at this point in time. Health information is exchanged primarily through fax. We've spent hundreds of billions of dollars on health information technology in our country, and we are still the only industry that is using fax as our primary way to exchange information.
Wow.
Yes.
The old-fashioned way, right?
There are a lot of complexities with health information, high degree of security and privacy concerns that have been limitations with regard to the way that we're using things electronically. It's not like we can just send an email with somebody's health record attached to a different facility. It doesn't work that way.
That's where health information exchanges come in.
Correct.
So do patients have to give consent before their medical information is shared between two organizations?
Yes. So patients always have the right to control what happens with their health information. And so if our patients say, no, we don't want our records to be exchanged, well, typically if we were going to refer a patient to the University of Utah for a consultation and the patient did not want their records sent, then that consultation likely would not happen, because health professionals need information about their patients, obviously, to make decisions. But the patients always have a right to control what happens or does not happen with their health information.
So as a practicing physician, are there times when you know patients could have received better care if organizations had the ability to share information freely and safely?
Absolutely. Without question, there may be circumstances in an emergency room, for instance. If a patient shows up and is not fully conscious and decisions need to be made in the moment, and if a patient is on certain medications, there are risks that go along with making decisions without knowing, for instance, all of the medications somebody is taking. There are a host of examples where this could come into light.
Talk about how a patient's information is shared confidentially with a HIE.
Sure. Right now, when a patient will be seen at any hospital or clinic, most hospitals and clinic, now we have what are called electronic health record systems. Those are, it's an electronic way to capture information about a visit, the note from the visit, laboratory results, imaging results, and those records are stored on servers that are typically in the basement of these hospital systems. Some are based in the cloud. You know, this is the way technology works. And it is up to us within each facility to monitor and guard the privacy and security of health information. There are lots of risks that we face. It's not typically hackers from China, for instance, that may be trying to get into our records. It's people being not as attentive if they've got somebody's health information pulled up on their screen. There are a lot of human errors that go into the protection of health information. And so in addition to putting up all of the firewalls and encryption layers that protect from outside attacks. Of course, you hear about things that you receive in the mail. If you open up an attachment that's got a Trojan or a virus of some sort attached to an email. So again, those are teaching our users to be careful and protect health information. So there's lots of things that we do within our individual organizations. When you start talking about health information exchange, we're combining record systems from different organizations into one place. And so it's a different level of scrutiny, but there are different risks that go along with that as well. And so the health information exchange organizations typically have a much higher level of security than any one individual medical facility has.
Thank you so much for sharing that information. And thank you also to Dr. Berner for sharing information about health information exchanges. I'm Sarah Medley. This is Healthy Living for Life, and thank you for joining us.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.